Very much, Ben, and good morning, ladies and gentlemen. I am speaking today on behalf of the Maine Medical Association, as well as from myself. I have practiced surgery in Portland for over 40 years. I'm now retired from that vascular surgery career. I, however, have not been a stranger in Augusta. I have had an appointment to something by every governor of this state since John Reed in 1967. And I want to share with you simply 3 of those programs in which I had the opportunity to have a leadership role, and why they have such a significant impact on what we're talking about today. Let me just remind you of something that many of you probably have forgotten. Most of you weren't alive then, but in 1967, the National Highway Safety Act was passed in this country by the federal government. And it simply said, if you want to continue to be part of the interstate highway system, you must create a medical system in your state to treat the emergencies that will be created by somebody traveling on those roads. Now, no state could afford to build their own I-95, 295, 395. And so we created, from scratch, an emergency medical system. It wasn't easy. It was a federal mandate. But I point out to you what we have now because of that. We have one of the best emergency medical systems for a rural state in this country. We have fully trained emergency medical technicians who can care for most emergencies. We have a fleet of vehicles that far exceeds the quality of the funeral director's livery service that was provided prior to that. We have now fixed wing as well as helicopters assisting in treating those injured on main highways. We have done the very best job we possibly can for the people of the state of Maine, and we should be very proud of that. Secondly, it was my privilege to chair the partnership for Tobacco-Free Maine Advisory Council when we were given a substantial amount of money because of our extremely high incidence of smoking, particularly among teenagers in the state of Maine. I am very proud to tell you we committed the highest percentage to cessation and prevention of any state in the country because of that, and we saw substantial reductions in smoking rate in the state of Maine. From that initial allocation derived the Fund for Healthy Maine. And while we've seen a variety of other health initiatives derive their funding because of that, we now see in this budget proposal money taken away from that, from those very precious prevention dollars. Because if we do not invest in prevention, we will have no loss of risk in the future. That's very unwise to take away those dollars at this particular time. We now see that fund rated to balance the budget, but we're no better, which makes us no better than any other states who spent the money in the first place on fixing potholes. Thirdly, it was my privilege to chair the Dirigo Health Initiative Board from its inception until I finished my term 2 years ago. Dirigo Health is the most successful program ever in the state of Maine to cover the uninsured. A legacy of almost 1 million months of coverage is a tremendous legacy, and why those who speak of Dirigo in a negative tone are totally lacking in reality. It's the most successful program we've ever had. Its focus on prevention really galvanized the rest of the field, and now you find most commercial carriers committing to prevention, as did Dirigo from day one. It was a subsidized private sector project. We helped people pay their premium from 20% to 80% of those purchasing a health insurance plan from initially Anthem and secondarily from Harvard Pilgrim. I am amazed that the Republican congressional platform at this current time includes subsidized premiums as part of their solution for health care coverage, while we in a state are abandoning this concept as something we can no longer afford or feel is appropriate. And at a time when we finally have insurance committees documented and agreeing to share their savings, which we documented year after year after year with Dirigo, sharing their savings to subsidize and continually fund the Dirigo program, we find statewide policies to abandon the Dirigo plan and allow the insurance companies to keep their savings as profit at this time. I think it's a very unwise decision. The Maine Quality Forum is a terribly important part of the Dirigo initiative, It continues, and I think with great support. It is the major quality facilitator for healthcare in the state of Maine, bringing other organizations together. You cannot hook cost containment unless you bring in quality initiatives. And that's what this proposal before you today emphasizes. That's the way to go to contain money and save costs. I want to thank the doctors of Maine who have continued to be participating physicians in the Medicaid program. Medicaid doesn't pay doctors very well, but you find doctors, we have the highest percentage of doctors agreeing to participate in Medicaid in most states around this country, and I'm so terribly proud of all of them who continue to do so. Last night, Governor LePage mentioned domestic violence. It is an issue that's very near and dear to me. It was my theme when I was president of the American Medical Association. I felt that doctors and medical profession could do better. And so that's why today, when you go into any healthcare facility, whether it be an emergency ward, a primary care doctor's office, a pediatrician, an obstetrician's office, an orthopedist's office, that doctor or his staff will ask you about violence. Are you safe at home? Has anyone tried to hurt you in any fashion? Because when we talk about violence, I prefer to use the term family violence, the greatest oxymoron I can think of, which brings together child abuse, both physical and sexual, domestic violence, as well as elder abuse, the significantly most increasing kind of abuse we have in our state of Maine right now, mainly because it's given by caregivers. But as we talk about that, the screening that occurs for those individuals who are victims is terribly important. We cannot shut the door to victims of family violence by eliminating their access to health insurance. And that's what this budget is going to do. Finally, if you have no insurance of any kind, public or private, there is a 25% increase in the mortality of the common causes of death. Now, that doesn't mean 25% death rate. It means if the rate is 4%, yours is 5%. If it's 20%, yours is 25%. Simply because you don't have insurance. Ladies and gentlemen, this is not an economic budget issue. This is a life and death issue. I'm here in behalf, as advocates, for our patients, for those who currently are covered under the Medicaid system, and those who are going to need to be covered under the Medicaid system in the future. Thank you for your time.